Mantra. Mantra, you can start.
Good evening, everyone. My name is Antara Ghosh, and I am pursuing my BSc in Forensic Science from Parur University. Today, I will be your host. We are delighted to have you all join us for our webinar series, Future Tech in Forensics, a dive into past. This webinar series is presented in collaboration with the Department of Forensic Science, Applied Sciences, Parur University, and Forensic Talents, India. Under the direction of 12 different experts, we cover 12 different forensic science fields. This online webinar series focuses on the latest developments and future projections in the field of forensic science. Forensic investigation is a critical aspect of criminal justice, employing scientific methods to analyze evidence for legal proceedings. Research in this field focuses on advancing techniques for crime scene analysis, DNA profiling, ballistics, and digital forensics. The goal is to enhance investigation accuracy, efficiency, and reliability in identifying criminals and presenting evidence in the court of justice by proper research. In order to understand the various aspects of investigation regarding asphyxial death, today's seminar is being conducted. All participants will be given an e-certificate after the finishing of each webinar. To get your certificate, fill the feedback form. Link of the feedback form is shared in the chat box after the expert's talk. If any participant have any queries related to the topic, feel free to ask your question in the chat box or on YouTube comment section. Expert will give the respective answers to your questions in the last 10 minutes. The topic of today's webinar is Future Directions in Research and Technology for Investigating Asphyxial Deaths by Akshara Yesodharan ma'am. To invite and introduce Akshara Yesodharan ma'am for this expert discussion, I would like to extend an invitation to Mr. Arun Kumar Kawad, CEO and founder of Forensic Talents India. So,
Good evening, all. Our today's speaker is Akshara Yesodharan. Welcome, ma'am. We are very happy to have you here and you accept our invitation. Akshara, ma'am, is graduated from the St. Xavier's College, Ahmedabad, Gujarat. Her specialization is in botany. She completed her post graduation in forensic science from the Gujarat University. She, she has a specialization subjects in forensic medicine, biology, and serology. Right now, she is working as an assistant professor in Parul University. So we are very happy to have such a great speaker in our on our platform. Ma'am, now it's on you. You can share your screen and presentation, ma'am.
Thank you, sir, for giving me such an opportunity on your platform to present something on your platform. It's very delightful for me as well, and I hope that this session be a fruitful one and same for everyone. Yeah. So just let me know if my screen is visible or not.
Ma'am, you can share your screen. We can't see.
Just a minute, sir. Hello.
Yes, ma'am.
Sir, is my screen visible?
Yes, ma'am. Your presentation. Yes, now it's seen.
Okay. Okay. So yeah. Uh, my topic to present today is about future directions and research and technologies for investigating asphyxial death. Myself, Akshara Yesodharan. Before starting or discussing anything about the research directions or about the research technologies, first let us just I'll conclude what all the things I am going to discuss today. Firstly, we'll be discussing what is asphyxia and what are the causes of asphyxia. And next thing we'll be discussing is about the medical legal importance of asphyxia. And the last topic I'll be concluding with is the research trend in analysis of asphyxia. So, starting the topic with asphyxia. The word asphyxia means itself is that the absence of any kind of pulsation. But when we talk about in forensic medicine, it technically means the lack of oxygen in a person. And it can also be described as an interference in the respiration due to any cause, like be mechanical or environmental or toxic. Anoxia is referred to complete absence of oxygen. Now, when we talk about asphyxia, there are certain causes of asphyxia, and that are that the deaths caused by hanging or strangulation or suffocation or drowning. Now, let's just discuss each cause of asphyxia. The first one is hanging. Now, what is hanging? Hanging is it can be defined as death produced by suspending the body with the help of a ligature that is tied around the neck, and which will be constraining and producing the force, due to which the weight of the body will be constraining and the respiratory system will be choked. So this is about hanging. Now, when I talk about hanging, there are two different types of hanging. That is atypical hanging and typical hanging. Now, what is typical hanging? Typical hanging is a particular position in which the body is being with no contact with the ground. The full constriction of the body is being done. But when somebody is talking about an atypical hanging, it does mean that the feet or the some of the body part is touching the ground, or it can be called as partial hanging. Now, an important term when we talk about hanging is ligature. Now, what is ligature? Ligature is any type, it can be anything. It is a mean of any material which constrains the body and which ultimately chokes the respiratory system, causing the death. Now, ligature, it can be anything. It can be rope, it can be dupatta, a sari, a dhoti, a sheet, or handkerchief, or anything, be it any kind of body part, it can be anything. Now, there is an important aspect regarding ligature, because when there is an investigation around hanging, the investigator has to properly check that what kind of ligature has been used. Because why? They need to check that particular ligature, that which they have recovered from the scene of crime, is capable enough to uh, bear the weight of that body. Is the tensile strength of the ligature appropriate according with comparison to the weight of the body? Right. Now, what are the symptoms of hanging? What are the effects that on a body which we can see when a body is being recovered due to hanging. So when the initial symptoms which we can see for hanging is loss of power sensation like flashes or light or noise. There is no senses towards these things, and it is followed by unconsciousness. But since the onest of the unconsciousness is very fast, hanging may be considered as painless mode of due to fast onset of unconsciousness. It may not be possible to save oneself in accidental or suicidal hanging. Now, talking about hanging, what are the causes that leads to the death due to hanging? It can be asphyxia, that is the ligature which is blocking the respiratory passages, or it can be venous congestion. What is venous congestion? Venous congestion is nothing but the stoppage of supply of blood to the brain, or it can be a combined effect, that means asphyxia as well as venous congestion, and it is generally the commonest cause of death. Now, how is the management of the hanging case done? Generally, the first step of management case is to remove the ligature immediately and to preserve the ligature properly as it is, because to study the kind of ligature and how it was used at the scene of crime. Also, artificial respiration should be given immediately, and the person should be shifted to the hospital at the earliest, because the first step that any investigator at the crime scene taking is to give the medical assistance to the needy person. And the person who survives may have convulsions or loss of memory or some brain. So this was about the management of hanging cases. Now there are some external examination as well as internal examinations. So when we talk about the difference between antemortem features and postmortem features in hanging, the first we'll be talking about is the motive. Whenever the doctor is questioned, the first question generally the police has been asked is whether the hanging was an antemortem hanging, or whether the death was an antemortem or an postmortem. Also, the second point which we can discuss is about the ligature mark. Ligature mark can be well developed, or in case of antemortem it can be well developed. But when we see in the case of postmortem, the feature is not that evident on the dead body. Also, a main feature in hanging, in antemortem hanging, is dribbling of saliva. But when we talk about the post-mortem hanging, the dribbling of saliva is absent. And as the if the ligature is rope fibers, you can see rope fibers even in the hand. The fibers, the residues of the fiber can be seen at the hand of that particular victim. And if it is in post-mortem hanging, you cannot find any kind of, or you can barely find any fibers in the hand of the victim. So this was about hanging. There is one more type, that is autoerotic hanging or sexual asphyxia. Generally, when we talk about hanging, um the major victims, there is no age bar regards hanging or anything. Every age group, every person from a different age group can be a victim. But the reports or the research says that the major victims are the males. So this was about hanging. Now moving on to the second cause, that is strangulation. Now, what is strangulation? Strangulation is nothing but a violent form of death which occurs from the constriction of the net by means of ligature or other means without suspending the body. So, the main difference between hanging and strangulation is the suspension of the body. In hanging, the major cause of the death or the respiratory choke is because of the suspension of the body. The neck or the respiratory system has been constrained by the weight of the body. But when we talk about strangulation, there is no suspension of the body. Now, there are different types of hanging, that is throttling, mugging, barnstola, or garroting. Now, discussing about each types, that is throttling. Throttling, it is defined when the constriction of neck that is being produced by any finger or palm of any other person. Now, here the force is an external force. And next we'll be talking about is mugging. What is mugging? It is a constriction of neck done by the foot, knee, or bed or bend of an elbow. That is called mugging. Bansdola, this particular asphyxia is being seen around North India. What is done is a strong bamboo is put around the neck on one back, and these are tied by the rope. Now, this constriction is causing or by squeezing, sometimes squeezing is done by the foot pressure of bamboo. So, this was about Bansdola. Now, the next type which we can discuss is about garroting. Garroting, this was practiced by earlier days by thugs for committing robberies. They used robe and handkerchief, which is suddenly thrown from the behind around the victim's neck, and the pressure is suddenly applied. Since unconsciousness has been developed, the victim is unable to fight back. Now, what are the postmortem findings in this? Or what are the external or internal findings in this? So, the first thing we can find is in external finding, that is ligature may be seen on the neck. It is not necessary that in every case of strangulation we can find ligature, but it should be photographed in suit, and after removal it should be preserved and handed it over. What else is sometimes clustering of this bruises because of the ligature can be seen, and small linear or crescent marks also can be seen around the neck, which is caused by the pressure of fingers or ligature mark that is being used around the neck of the knee. Also, certain internal findings that we can see is when the dissection of the neck is done in the bloodless field, as blood is discharged from the neck vessels, may give erroneous result. To achieve this, the dissection of the neck should be done after removal of the brain. And what are certain medico legal importance of strangulation are complete post-mortem examination, which is essential to certify that death has been caused by strangulation or not. Also, we should find that the natural folds in the neck may sometimes create confusions. As we see in persons who are having a healthy body, we can see a natural fold that is already present. Uh, it can be mistook with the ligature mark, but it can be a pseudo marks, which can create a confusion. Also, suicidal strangulation is very rare. Although it is reported in lunatics, it is not possible for any individual to strangulate himself or herself, as once unconsciousness supervenes, the ligature pressure decreases. So there is a minimal chance or less negligent chance that a person uh, can strangulate himself. and suffocate himself. So this was about suffocation. As we have discussed about hanging and strangulation, there are certain difference in hanging and strangulation. The main difference which I have discussed was the suspension of the body, which is present in hanging and as well as which is absent in strangulation. Also, the presence of defense mark is mostly absent in hanging, because generally when we talk about hanging, it is more of a suicidal nature. So defense mark is being absent in hanging, and which can be clearly seen in strangulation. So this was about strangulation. Now the next type of hanging is choking. Choking, it is defined as an obstruction of air by the passage from within. Now, mostly choking can be accidental due to an impact of foreign bodies, like it can be anything, be it coin, be it button, be it fish bone, etc. Now, the foreign body induces laryngeal spasm, which causes the air passage to be blocked completely. Even a small foreign body can induce laryngeal spasm, which results into killing the person. Now, certain diseases also can choke person, like tumors may press on the air passage, or vomitus may press on the air passage and produces laryngeal spasm. Now, there are different types of choking. That is traumatic asphyxia. Traumatic asphyxia is a kind of mechanical fixation of the chest, which is sufficient to cause the death. This is called traumatic asphyxia. For example, if you can say, is it may occur in a big crowd, like in a fair, where people may be trampled, or pressure on the chest may occur, which is causing the death suddenly. And the other type of choking we can discuss is inhalation of irrespirable gases. There are situations occurring where inhaling of certain gases which are not meant to be respired enters into the system, and which ultimately suffocates the system and cause the asphyxial death, like gases like carbon dioxide, carbon monoxide, or hydrogen sulfide. When it enters into the uh, system, it suffocates the person and ultimately causing the death of the person. And the next type of asphyxia, the type we can talk about, is cafe coronary. Now, it has been reported in many cases that a person sitting in a cafe or bar may suddenly collapse and die. It looks like he had a massive heart attack, but post-mortem examination, if we can find, is a small bowls of food or fish bones are present. So this particular incident or is given the term as cafe coronary. Now, when we talk about the post-mortem findings, that is external or internal findings, is generally choking is an homicidal in nature, because one person cannot choke himself with something. So generally when we talk about choking, it is homicidal in nature, and homicidal smothering effects produced by any forcible closure of mouth or nostrils, or aberrations or contusions around mouth or nostrils can be found, or we can say defense marks can be found around the face. Also, certain fractures around the septum of the nose can be seen due to the struggle, and aberrations may be seen on the cheeks or lower jaws. So this all are the external findings which we can find in choking procedure. And the talking about the internal findings which we can see in choking processes, foreign bodies like cloth or mud or coin or any kind of bone that is present in the throat or trachea area, the because of which the air passage is being completely congested. Also, certain times, if the choking is being caused because of inhaling any unwanted gases, if we are talking about the arson cases, so because of some inhaling certain gases, we can find soot particles also in the bronchial area. And what are the medico legal importance of this particular choking is, the detailed postmortem examination is very important to establish whether the suffocation has been caused by cause of the death or not, or is if it is a suicidal in nature or not, or accidental suffocation or an homicidal is in nature or not. So for finding such things, it is very important, it's medico legal importance. Now there are certain other terms that comes with choking is Burking and Barnstola. Now, Burking is a classic example of choking. This was done by two people that the name of the person is Burke and Hay. Now, what they used to do is they used to kill their victims. How? What they used to do is they used to throw their victim down on the ground and used to kneel on the chest, and they used clothes to close the mouth and nostril with one hand and firmly holding both the jaws together, which ultimately blocks the air passages. They used to kill the person. Why? To supply the dead bodies to the medical colleges for dissection. So this was one of the classic example of burking. Now the other term which I told is Bansdola. Here the method is bit different. Here the victim's chest is being compressed between two wooden planks by the assailant, which ultimately causes the rib to fracture, and even lacerations can be found in lungs. So this was about our choking. Now next term, the next cause of asphyxia which we can discuss is drowning. Now drowning, it has been defined as a form of death which has been occurred when the atmospheric air is prevented from entering into the lungs due to the submersion of body into water, or the presence of some other kind of fluid into the system which obstruct the air passage. Now there are types of drowning there. So types of drowning is wet drowning, dry drowning, secondary drowning, and immersion syndrome. Talking about the wet drowning, it can be in fresh water or in sea water. The post-mortem of both the fresh water and sea water can be different. The basic difference between both of them can be the presence or the kind of species of diatoms that can be uh, that can be present in both the water bodies that is being extracted from the sternum bone. And talking about the dry drowning, so sometimes as water enters the passage, it induces the laryngeal spasm, so which ultimately completely closure of the air entry into lungs, which results into the water that not reach the lungs. Now talking about the next type of drowning is secondary drowning. It is when death occurs after some time when a person is being rescued, and the death may be occurred due to the aspiration, pneumonia, or electrolyte imbalance. So secondary drowning is something which has been caused after that person has been rescued, and it can be said that it is in some after effect of drowning that has been obstructing the respiratory system, which ultimately causes the death of the victim. Now, talking about the immersion syndrome or cold water drowning, so it is caused by when sometime a person is dropped into a cold water and the skin receptors are activated immediately. Consequently, suddenly dysphonia and sometimes vagal inhibition occurs, as a result which the heart stops immediately. Now here we'll be talking about what is the mechanism of drowning. So whenever a person jumps into a water or is thrown into a water, that person will be sinking to the depth of that proportion to the momentum of his fall. But because of buoyancy and struggling movement, he come to the surface. If he is not a swimmer, he cries for help but struggle to keep mouth above the water. Now, during this process, water enters into the respiratory passage and induces coughing, which results the body become heavier and it further goes down. Now, due to the movement of hands and feet, he may rise further and take more water into the lung. This will be altering rise and sinking continues till he becomes unconscious. Due to the unconscious now, he has set in and weight of the body, due to the weight of the body that has been gained due to the water entry, he'll be keep sinking to die. Now, in freshwater drowning, the water being hypotonic, that is, the concentration is less, is being absorbed into lungs immediately, and the pulmonary circulation as a result, the increase in blood volume and the concentration of sodium or potassium falls. Now, what happens is, as a result of which potassium concentration goes up in the blood and sodium concentration relatively falls, due to which increased potassium causes the ventricular fibrillation, leading to the fall in blood pressure. So this was about the mechanism of drowning. Now there are certain symptoms of drowning which are causing the death ultimately. That is, the first cause which we can discuss is asphyxia, the commonest cause, and the second cause which we can discuss is about vagal inhibition. Now, this may be seen in some cases of cold water generally. Next cause which we can discuss is about syncope. Syncope, it can be elliptics and suddenly fall into it, occurs because of elliptics and suddenly due to the fall in water. And also there can be some injuries found in the person, and which are being sustained or caused due to the fall in water, like head injury if struck against any hard surface, or fracture or any dislocation of cervical vertebrae may be there if the person falls into the water from a height. Also, if we talk about the fatal period of asphyxia in this case can start within 2 minutes of the submersion, and also the death can occur in about 5 minutes. Although heart may continue to beat for 10 minutes, if the water is cold, death occurs early. Now, what are the post-mortem findings that we can find in drowning cases? The external findings which we can see is the clothes may be wet if examined early. Also, the eyes can be usually pale, are opened or closed, and congested, and pupil can be fine. Also, when we talk about the tongue, it can be swollen or protruded. Also, a fine white lathery froth can be seen from the mouth and the nostril. Also, a particular feature that is found in drowning cases is goose skin. Why? The granular and the puckled appearance of the skin that has been seen on the front surface of the body, especially on the limbs in the water season during contraction of the involuntary muscle. This particular is being termed as goose skin. What else we can find as an external finding is washerman's hand. Now, what is washerman's hand? If you have noticed, if our hand is being frequently kept in water, the kind of pale color, the bleached effect our hand is getting, so that kind of somewhat effect can be known as washerwoman's hand. What happens here is the skin of the hand and feet maybe show as bleached and sodden appearance due to prolonged stay of the body in water. Maybe it can be 2 hours, 3 hours, or from 10 to 12 hours. Now this particular term is known as washerman's woman hand. Also, the rigor mortis appearance early in the case of drowning. And there are certain internal findings which we can see is the chest findings are quite typical in drowning. The lungs are like balloons, they overlap hard and may protrude out of the chest wall when it is opened, because the entry of the water which has been increased in the body, the concentration of the water, which causes the lungs to swell up. And also on a section, frothy fluid mixed blood can be exuded when it is cut. Fine froth may be seen in trachea as well as in bronchi. So this was about certain external and internal findings. Now when we talk about the post-mortem and ante-mortem features of drowning, is when we talk about froth. Generally, froth is found in ante-mortem drowning cases. A fine lathery froth has been present around nose or either around mouth. But when we talk about the post-mortem found drowning, it is generally absent. Now, motive, it can be accidental when we talk about ante-mortem drowning or suicidal, but mostly in case of post-mortem drowning it is homicidal, or the death to be disguised as an accidental suicide. Now when we examine the lungs in both the cases, in ante-mortem drowning and post-mortem drowning, what differences we can see is when we examine lungs in an ante-mortem drowning, bloated overlap heart are intended with rib marks and grossly odomentous. But when not talk about post-mortem drowning, water may be seen in lungs. Also, asphyxial findings will be seen in antemortem drowning, but signs of deaths from other reasons may be seen, like a shock or a coma can be found in an post-mortem drowning. Now, there are some tests in drowning which has been particularly done for drowning cases. That is the test of diatom. Now, diatom are nothing but an kind of a species of algae that is present in water body, as the exoskeleton of diatom is made up of silica. You can see a glassy structure of the microbe which is being ornamented with silica and which can be found in the sternum of or the internal organ of the body, because of the respiration under water in drowning cases. Now this was about the this was about the asphyxia. We have discussed all the causes and the medico legal importance of asphyxia. Now, investigation of asphyxia, how it is done is, now the post-mortem examination, which reviews the medical records and accidents, reports, and photos are taken at the scene, which is used to analyze and classify the asphyxial deaths. Now, here, non specific physical signs that has been used to attribute the death of asphyxia. Generally, in the case of asphyxia, again, the basic procedure is being carried out, that is medical assistance and variegating the scene, and again, findings has been done whether the particular death has been occurred due to uh, some accidental cause, or whether the nature of the death is in homicidal or suicide. Now, there are recent trends of analysis in the research, that is, the use of biomarkers in the diagnosis of prenatal asphyxia. Now, this is the prospective study which has been conducted with an available samplings of infants, that is, infants upper 35 weeks. A neonatologist perform a neonatal clinical examination here to diagnoses this kind of asphyxia and neurological functions of neonatal. This can include a systematic assessment of mental status as well as the cranial nerve function and motor and sensory systems. In particular, the motor examination assists spontaneous movement and muscle tone. Also, the posture and resistance of the muscle of the passive movement were used to assess active tone in newborn neurological examination, were performed by single neonatologist and experienced the neurological evaluation without knowledge of the cytokinin concentration. Now, the data were analyzed by the help of t-test and chi-square, and the next trend which we can discuss about is prognostic risk score development of the predict in birth asphyxia. Now, this might be the reason where the babies born after extended labor have a larger danger of birth asphyxia and the birth trauma, which will lead to an umbilical cord difficulties or the stress of too many contractions. Prematurity was an another prognostic determination of the birth asphyxia, but which was in line with the study of the farm. Babies which born earlier than 37 complete weeks of gestation may be exposed by birth asphyxia or due to unsatisfactory amount of surfactants in the lungs. Now, surfactants generate an uninterruptedly reforming surface layer over the alveoli, which diminishes the surface tension, which prevalence and maintenance maintains the alveolar stability. Here, a pulmonary deficiency in pulmonary surfactants production causes a respiratory distress syndrome. The furthermore, nomenclature cord was in prognostic determination of the birth. This was about the prognostic research score development to predict the birth um asphyxia using maternal and fetal characteristic in the southern gonad zone. Now, the next topic or the next trend which we can discuss about is the post-mortem medico-legal study of violent asphyxial deaths. It is an autopsy-based study. Here, the study was conducted in mortuary uh, in Delhi, in one of the district in Delhi, to determine the frequency and epidemiology of violent asphyxial deaths in the region in relation to age and gender variation. Now, the duration of this study was from 1st of January 2012 to 31st of December 2030. The results from this study that has been given is that the medico legal deaths were identified to be violent. Out of 2,479, 219 deaths were identified as an medical as an violent asphyxia, whereas making an incidence rate of 8.83%. There were 149 males and 70 females. Here again, the male is predominance when seen in all asphyxial death cases, except manual strangulation and smothering. And hanging and drowning were leading cause of the violent asphyxia, because it is generally possible a person can hang, because when we talk about strangulation, a person after a certain limit cannot strangulate himself. So the major cause of violent asphyxia we can find is here is hanging as well as drowning. Now, the conclusion of this particular study is that the immunotoxicity by the cypermethrin insecticide is not similar in male and female subjects. So this was about the certain trends in investigating the asphyxia and about a detailed information about asphyxia. So I'm concluding my lecture here. Thank you for listening, and yeah, if there is any question regarding this session.
Yes, ma'am. There are some questions. The first question is: are there specific tools or technologies that aid in the investigation of asphyxial death?
um Yeah, there are the major aid which we can use is the postmortem findings that we have found by the doctor, which is generally used as an results for the report.
Okay, there are some questions on from YouTube also. How do forensic experts assess the possibility of suicide versus homicide in case of asphyxial death?
So can you repeat the?
Sure, ma'am. Uh, how do forensic experts assess the possibility of suicidal versus homicidal death in asphyxia?
Okay, so there are many factors that has been affected. That is, it can be there are certain factors, many factors that we have to note down. That is, what are the circumstances, or the what are the crime scenes that has been found around the crime scene. What is the ligature mark that has been found, or the ligature that has been found around the neck, whether that particular ligature is able to constrain or to hold the weight of the body, or the tensile strength is enough or not. One major thing which we can see is the defense mark that is present on the victim's body. The presence of defense mark itself shows the presence or presence of struggling, or the around the victim or the circumstances. So yeah, this so there are certain factors. There is no one single evidence which can conclude that it is an antemortem or post-mortem. There is a set of factors which with the help of which we can conclude that whether it was an antemortem or an post-mortem one.
Okay, ma'am. How do external factors such as ligature material or environmental condition impact the forensic analysis of asphyxial deaths?
So when we talk about external factors, let's talk about an drowning cases. Okay, so there are chances that the because of the environmental condition, let's just say that the condition is the temperature on the around the environment is too high. So due to the degradation, or yeah, degradation of the body, it is very much uh, 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 it becomes the time constraint becomes very important, because after degradation it is bit impossible, or it is too hard to analyze what can be the cause of the death, whether it is an antemortem death or post-mortem death. So yeah, external features can influence the analysis.
The last question: what legal concern apply to investigation of suspected asphyxial homicides?
Sorry, sir.
What legal concerns apply to investigation of suspected asphyxial homicide cases?
Okay, so the legal concern mainly comes with the fact that the findings, that whether it is an antemortem or post-mortem death. Now, whether if it is a post-mortem death, so it comes with different sections, and then it comes with different questions, that what was the mean of the death if it is a post-mortem death, post-mortem asphyxia. So, accordingly, the cause of the death which has been caused, the legal terms or the legal sections will be changed.
Okay, so that's it. Thank you very much for your time, ma'am. It's a very really informative session for all of us. Every participant, we have shared the feedback form link on YouTube as well as the Zoom chat box also. So you can fill that and give your important feedbacks. So, ma'am, thank you very much for your time.
Thank you, sir, as well for inviting me on your platform. It was a good experience for me as well, and I think that it is same for all the participants.
Yeah, sure, ma'am. Thank you very much again. Our next speaker is Meghna Sharma, and her lecture or on 12th March 2024. So we will share the Zoom details to the registered participants. Thank you very much, all of you. Uh, have a good day. Good night.